This is Doug.
And I'm Cindy.
Welcome to Help Me Help Mama livecast. Thanks for joining in. And, I was wrong yesterday. We got a rain, right?
We got a rain. We got about 3 inches of rain, actually.
We was counting on the rain, and it was like the hurricane in New Orleans, and we was hoping. Cindy's got a bunch of fruit trees and grapes and various and sundry other things, flowers, and it was getting dry, and we're going to have to do a bunch of water, and then thought, well, maybe we'll get a little bit of rain. It was calling for it, and then we looked on the weather map, and it looked like the old weather front was, skewing over to the right, and I thought, it's going to miss us. But it didn't. We got it. So, thankful for that. Rainy day yesterday, and don't have to water for a few more days.
A few more days.
Yeah.
But, and it's going to be beautiful the rest of the week. The temperatures are lower, and it's sunny, so it's going to be really a beautiful week. So, get outside and enjoy the weather. Hopefully, it's beautiful where you're at.
So we got two things to talk about today, and we want your input. Matter of fact, we are offering to meet, and I believe this was the last day of the offer, that if you'd like to talk to Cindy or me, we are offering to meet with you for free. What's the catch? There is none. We're just lonely and want to talk to people. But
no. Surely, most people have a specific issue that they that they want to talk about in relation to caregiving. So, how do they do this?
So they go to help.mom/meet for free, and a little calendar page will pop up, and you can just pick a time, and it's for like a 20-minute call. Yeah, if you'd like to talk to one of us about an issue that you've got going, we can't give legal advice, but we can talk and help you talk through it, and maybe whatever we can do in a 20-minute period. Today we're going to talk about two things. And the first one, we got this from Long-Term Care Community Coalition, and we've been hearing about other people recently. I think not last Friday, but the Friday before, we got on Facebook from a lady in Oklahoma that was behind an initiative in Oklahoma. And
to open the doors to the nursing homes.
Open the doors to the nursing
homes. Family and friends and care managers and whoever else needs to come in and see the residents, to let them in. It's like nobody has been speaking up for the residents. A lot of family members, there are 40 to 60 million family caregivers out there that are caring for somebody at home. There are also many of you who have loved ones in a facility, but it's kind of like everybody's in their own little place.
The staff at the nursing home, we know a bunch of them, and a bunch of nursing home folks are probably watching this today. So nursing homes are by and large doing a great job. They're trying their best to provide for the care of their residents. They're trying to keep the coronavirus out. If they are clean, they certainly don't want people coming in to bring in the virus to their facility where it's not a problem. If they are clean and don't have the virus in there, and somebody brought it in, it could be devastating. So they're naturally trying to be very careful. We understand all of that. But the rest of the stories, Paul Harvey used to say, is that, the nursing home staff is not family. They're not your spouse, they're not your kids. It's different. They talk to the residents, they're nice to them, they visit with them, they play games, but they're not family.
They're not family, and no one can take the place of family. There's a heart connection, and everybody needs this. Okay, Matt's going to read a question for us.
All right. Mary Salvaggio Clay says, my aunt is in her last hours. I'm praying they let her family in to be with her.
Absolutely.
Thank you, Mary. Yes.
The family should be allowed to be there. And this is what the Long-Term Care Community Coalition is trying to do.
And there is some sort of, and I was looking for this, some sort of exception for compassionate care situations. And Mary, you may ask the nursing home about that CMS supposedly has an exception.
Okay, what is CMS?
Centers for Medicare and Medicaid Services has.
This is a federal agency.
And they have a provision for compassionate care situations, such as end-of-life situations. So talk to the nursing home about that. Hopefully they will allow you in to visit. But this is, and we see this almost every day, you know, where families are like, they're standing outside the window and they're peeking in, and, you know, the staff has been really good. If mom doesn't have a phone, they loan her their phone, and mom's trying to talk on the phone that she may be unfamiliar with and visiting with her kids or grandkids or spouse outside the window.
But if mom is in the mid stages of Alzheimer's,
it's just not.
Is she going to really
Yeah,
recognize who's standing outside the window?
Yeah, and I just talked to a guy yesterday that he said,
now?
you know, my mom has got Alzheimer's in mid stages, and he said, I think it would just scare her, you know, to see this man, who's her son, you know, this man outside her window looking in, and she wouldn't she wouldn't understand somebody giving her a phone. And now, would it make a difference if he was in her room? I don't, you know, to visit with her. I don't know.
Wait a minute. Now think about that. He can talk to her. Will she remember what he says? Maybe, maybe not. But if he puts his hand on her hand and she feels that, is that not conveying more than just words?
Obviously, yeah.
She's feeling that.
And sometimes it's a combination of senses. If it's just he's standing outside the window talking, she may see him, but that's it. But if he's there in the room, she can feel his presence, the touch, the sight, the sound.
His real voice.
Yeah. And all of these things, yeah, they do make a difference. So it's, you know, when this started in March, and, you know, the rules started changing, and it's like, okay, we've got to do this new rule where, you know, family can't come into the rooms, and it's this staff. We didn't know how long it would last. Of course, the nursing homes didn't know how long it would last either. And believe me, if anyone is so tired of this virus, it's people in the nursing home. They wish it'd go away just like that, and everything could be back to normal. But so it's not their fault in any way, but the legislators, the rule makers, this is groups like this is who they're talking to, like, hey, this has gone on March, April, May, and we're halfway through June almost, and something needs to change. You know, our parents are dying, our spouses are dying. It's not good. We need to be in there. And yes, this will be more work for the nursing home staff. They're already overloaded. They got more than they can do. This is more work, but you know, there is a huge trade-off here, and the trade-off is, you know, families, and, you know, family connection, and the love, and just for the residents to be there with family. That's a big thing.
They're probably lonely.
Oh,
They're probably brokenhearted, and it's very difficult to be brokenhearted even if you're young. But imagine if you're elderly and you just feel like you're isolated from everyone, and I could see how it would really cause them to decline.
Yeah. Put your comments down in the comment section. Good, bad, or ugly. I mean, there's obviously two sides to this. So put your comment. Hopefully there's no bad or ugly comments. So just good comments. But let us know what you think. Let us know what you've done to communicate with your loved one, or if you work in a nursing home, what you guys are doing. I know you're doing as much as you can do, but again, you're not family. So what you're doing to help. And hopefully this rule will, number one, the virus will abate. We're all like ready for that today. And number two, hopefully these rules will change to allow at least one family member. That's what this group is advocating, that there be one designated family member that would be allowed to go in on a regular basis, and obviously subject to testing, wearing a mask, wearing gloves, whatever's required to make it as safe as possible, you know, for the staff and for the other residents of the nursing facility.
Right. So whatever is required of the staff as they walk in the front door to go to work.
Yeah, the same thing is
the same thing
that's required of the staff should be
Absolutely.
required of any visitors that's going in. And hopefully there can be meeting places now that the summer months is here. There may be meeting places in the facility or outside. A lot of facilities have courtyards or outside meeting areas, and so even if the meeting place was outside,
a big covering in the front. A lot of them have a big covering, so it's shaded. There's breezy, and they could bring your loved one outside.
So we got another.
Well, it's just Glenda from West Georgia and Michelle from Mooresville, North Carolina. They're just saying thank you.
Oh, well, thank you for joining us.
Thanks for joining us.
Yeah, appreciate that. And if you are a caregiver in a nursing home, please type in your thoughts or what you're doing in your facilities to help. And like I say, I know it's a lot, but let us know. Feedback in this group, the
Long-Term Care
Long-Term Care
Coalition has asked for feedback. So if you have stories about loved ones in a nursing home, please contact them.
Feedback at ltccc.org, and you can let them know how you feel about this and your input on this. And this is a time to say if you'd like to meet with either Cindy or myself, because this is coming down today. We blocked aside a portion of our schedule to meet with people that maybe you're struggling to provide the best care for your loved one and just need to know, am I missing something, or what is a good plan, or help me with my plan, or I would just want to talk about something. Then contact us, and we'll put the link there, but it's help.mom/meet for free. help.mom/meet for free.
So what the Long-Term Care Community Coalition is doing is they have a blueprint for restoring residents' rights. Go ahead and read. Do you want to read that? Residents' rights to visitation and care. So go ahead and go to feedback, FEEDBACK at ltccc.org, and give them your feedback. Let them know. We all know if there's a public voice out there and it goes to the right place, things can change.
So Marie says, my mother was in rehab and kept telling me she didn't want to die in a hospital or nursing home. I brought her home. Set up hospice. Within days, the nursing home had the virus. I'm so thankful I brought her home. She did pass away, but on her terms, and me by her side.
Then that made a huge difference in her life.
Marie, thank you.
Thank you for doing that.
Thank you for your comment. Peggy. Hi, Peggy. Peggy comments
Is it Peggy Way?
I
Hope you're
heard
doing okay today, Peg.
I heard that maternity wards were allowing new fathers, as it should be. Maternity ward were allowing new fathers into delivery rooms. Likewise, families should be allowed into rooms of loved ones who are quickly declining. Exactly. Yes. Thank you.
Thank you, Peggy.
I mean, I was there when.
Oh, I know.
Yeah.
You almost passed out.
Almost passed out. Yeah, when our number two, our daughter, who this was an indication of how it was to be, she was like,
yes.
Let me out of there. And she was like real fast. And Cindy's, I guess, eyes rolled back, and my eyes rolled back in my head, and I almost hit the deck. And the doctor said to the nurse, you watch her, I'll watch him. No,
the nurse took the baby, the doctor took you, and I was sitting there, what am I, chopped liver,
Yeah, I thought, but, I had to be in the room, so there I was. Wouldn't much help.
Yeah.
But it made a difference. It made a difference to me. And I think these, family, hey, it's a big deal.
I'm sorry. I mean, if my mom
Thank you.
was in a nursing home, they'd be hard pressed to keep me away from her.
You'd be clawing through the door.
I'd be going in or she'd be coming out.
Yeah. And they're just following the rules. I mean, they can't let you in. But I mean, I understand it's for people that are in situations where mom has to be in a nursing home, I mean, she needs that level of care. She has to be there, and they can't let you in. I imagine they have discussions with heated family members every day, and it puts them in a bad position.
Okay,
They
so
can't let you.
if a father of a newborn gets to go into a hospital,
Yeah, that's what Peggy's saying.
there are a lot of diseases and infections and things in the hospital, right?
Right.
And you know pretty much what's in the nursing home. I mean, people aren't going there to be treated for infections and diseases and things. It just seems like it's a safer environment. So why not let at least one, what are they calling them? They call them a support visitor in person. Let that one support visitor come in, whether it's family, friend, or other individual that's chosen by the resident, or if the resident doesn't have capacity, then a representative has the right to designate the support visitor in person.
So Nora says it's elder abuse not being able to see our loved one in assisted living. I have no problem wearing a mask, taking a temperature to keep them safe. The double standard is when the staff only takes precautions while on job at the facility, but not off the job, yet my family takes precautions 24/7. We can't even see them through a window. So
That's
yeah,
kind of scary.
it's kind of scary. They're just following the rules. I feel sorry for the staff that's there. They may feel the same way about it that you do, but you know, they can't. They would be fired on the spot. They would be, worse than that, they would be violating the regulations been set up by the state and federal government. But goodness, the rule, it's been long enough now that the rules need to be changed. That's the point we're making today.
That's it. Bring in calm and common sense. Treat everybody the same. You know, new fathers get to go in and visit. Staff gets to go into the nursing home. Let the support visitor in person come in. Be fair.
Yeah, be fair. Emotional issue, right? It's this time that the rules been changed. It's been long enough. We're opening things back up, for good or for bad, and you know, we can argue both sides of that. So, and it's still out there. I mean, in our state, you know, Arkansas, we're one of the states that, since things have opened up, you know,
Number of reported cases.
the number of reported cases have gone up. It's not like a pretend deal. It's not like, oh, we're all better now, or this stuff is gone, or this stuff is over. None of that. I mean, it's still here, and it's still bad. But
we're a rural state,
Yeah.
so there was a part of it that had been basically protected from this. It was the northwest corner, and now the numbers are rising.
now they're
there.
hitting their peak. Yeah.
Yeah.
And in different parts of the state, it's, yeah.
Yeah.
And New York, that hit their peak early, and now they're, I think yesterday was the first day there were no deaths in
Long
New
time.
York City, I guess it was.
And they opened up yesterday, so.
Do the feedback. We put the link there, and call your congressmen, your senators, let them know how you feel about this.
You know, if anybody else figures a workaround on this, I don't know what it would be, I don't know. But if you figure it out, let us know, because everybody wants to know how to get in there and see their loved one.
Okay, Debbie says, my mom passed away back in 2011. I do in my heart feel that there was something wrong. Sister put in there, couldn't get her out. 3 years I tried. So apparently one family member wanted her in, another wanted her out. Yeah, we see those issues too.
Yeah.
And Nora says, we have 1,500 plus people protesting their cities with no social distancing or mask, yet folks can't go to church or have funerals, etc. Yeah, you know,
Right?
there are a
Or
lot
go see
of,
your loved one in a nursing home.
you wonder, like I remember when the social distancing and closing things started, I went to our local bank that, you know, on a heavy day may have half a dozen people in the lobby, and they were closed. Yet across the street at Kroger, everyone in town was there. There were a couple
Yeah.
hundred people in there. I thought, I don't know, does this make sense?
And they didn't have masks on.
They did.
back
Well,
then.
yeah, back then, Yeah, now maybe it's like half of the people with masks on.
Yeah.
So,
half.
we've learned, hopefully we've learned a little bit, and certainly in situations where our elders are at stake, where their lives are at stake, their immune systems are already compromised. We've got to be extra careful because it doesn't take much. I mean, if they get a virus like this, that's it. But a lot of these things have been the same for years, like flu season. I know it was common. I remember I walked into a facility a few years ago, and it was in the winter season, and they'd had several residents die in that 1 month. This was before the coronavirus. This was flu. And, one of the workers there told me, well, this happens every year at this time of year. Like the people there, their immune systems are compromised. People come in from the outside. They've got colds or flu to visit their loved ones. And that was, I guess, that we weren't thinking. I don't know. That was just the way it was. We just kind of accepted that. Loved ones would go in with a cold or flu and pass it on to the loved ones. And a lot of people died. And that was, again, before the coronavirus. And now it's the same thing, but yet I guess if there's one good thing, it's hard to think there's any good thing about the coronavirus. At least it's got us to thinking that, hey, we need to be a lot more careful, when we go in, when we're allowed in again, whether it's a cold or a flu. To start with, if you got a cold or flu, you shouldn't go in at all. But, if we've been exposed to it, wash your hands, glove up, put on masks, do everything that they recommend that you do, that the workers at the facility has to do to make yourself as safe as possible. So when you do visit, you don't pass on any of this stuff or reduce the chances of passing it on to your loved ones there in the facility. But again, there's a trade-off between, yes, if people, regardless of how careful we are, more people going in, there's going to be an increased risk of passing this stuff on.
Or bringing it out.
But the flip side of that, not going in to visit your family, the risk of them just dying of a broken heart, that's a big risk too. And you can't say, well, that don't count. Yeah, that counts.
It counts.
Counts a lot. Okay, well, thank you for the comment today. Thank you for participating. I think we've got more comments today about this.
Go to feedback@ltccc.org.
And if you would like to visit with one of us, we're sitting around here lonely. We need to talk to people. And so if you'd like to talk to us, go to help.mom/meet4free, and we will talk to you about your situation. Again, we can't give legal advice, but we can hopefully help you come up with a plan to get a better going forward plan for your parents on a going forward basis. So thank you for participating today, for watching today, and we wish you the best as you work to help the loved one in your life get the best care possible.
And thank you for being a caregiver for your loved one. You are making a huge difference in their life.